As part of a bigger national programme, we're looking at the whole patient pathway for stroke. We've looked at a lot of data and are speaking to local hospitals, patients and professionals. Right now, strokes happen to over 100,000 people in England every year. They can cause serious disability and death, so early recognition is vital.
I was eating my tea and I couldn't get my words out, and then I dropped my knife. I started dribbling, and my wife thought I might be having a stroke and decided to call an ambulance.
You might think this is where the patient pathway begins, but it's actually much earlier. Living in an unhealthy way, along with having existing medical conditions like an irregular heartbeat, diabetes, or obesity, increases the risk of strokes.
When the ambulance came, I didn't go to my local hospital. I went to a specialist unit instead. I just wanted to get to hospital quickly, but the ambulance crew reassured me that this was the best for me.
While time is critical, national evidence shows that a specialist stroke unit, called a HASU, one that meets a specific set of criteria, gives the best outcomes for patients.
At the specialist centre, they had all the equipment, as well as the doctors and nurses who deal with strokes all the time. Seeing the therapists and the team around me doing all sorts of tests, I definitely knew I'd come to the right place.
In a HASU, they can identify quickly which specialist treatments need to be given. It's not just medication. For about 14% of patients, there will be thrombolysis, an injection which breaks down clots. But for all our patients, we know that having specialist teams makes a dramatic difference to long-term outcomes, not just to survival, but to your quality of life after stroke.
They started my rehabilitation really quickly, and I was surprised that the discharge team got me home so early.
For those that can, it's best for patients to recover in their own homes. This type of early supportive discharge improves both physical and emotional well-being.
My wife didn't think we could cope at first, but we had help from our therapists and the community team to make it work. They gave us the confidence to start picking up our lives again.
However serious or severe the stroke, whether it's full-time residential care, a support group to help deal with new challenges, or even help in returning to work, rehabilitation plays a crucial role.
I knew I came close to dying. I don't want to go through that again. So, I eat better now, go on walks every day, and drink less beer. Simple stuff, but it makes a big difference.
The biggest risk factor in having a stroke is having had one already, but it's never too late to minimise your chances of becoming ill again.
We all have a choice every day. Sometimes I wonder if I could turn back the clock and do things differently. No one ever thinks they're going to have a stroke. I'm just grateful that when I had mine, I had the best specialist care and support possible, and can still enjoy my life and my family.
It's our vision that reviewing the entire stroke pathway from prevention and diagnosis to treatment and rehabilitation will help us see fewer strokes, better outcomes, and better lives for stroke survivors in our local area.